Greetings everyone and welcome to the Disease and Medication Portfolio Instruction video. Let's set the stage here a little bit and help you understand what our vision is behind this project. We want a one-stop shop study reference for you, and we want you to create it so that it's completely customized and personalized to your desires so that you can best learn from it. We want a concise, high-yield reference tool that will allow you to be able to go back to it and very quickly refresh your memory on a certain disease process or medication that you'll either see in the field often or that you'll be administering. The purpose of this entire project, the disease portfolio and the medication portfolio, is for you to be exposed to all of the medications and diseases that a paramedic needs to know. We want to, of course, prepare you for National Registry. We want to ensure your success on the National Registry Cognitive Exam. And most importantly, we want to prepare you for entry into paramedic practice. Let's talk about some pitfalls to avoid as you're working on this project. Please, please, please do not copy and paste loads of information into your projects. The purpose of this is for you to read or somehow take in information, process that information, and then synthesize and create a highly customized, highly personalized study tool and reference. We want you to eat this elephant one bite at a time. Don't wait until the last minute to complete the assignments. Work on it over the week-long period of time that you're given and maximize your use of that time so that you can retain as much information as possible. Please don't use anyone else's. The point here is not for you to steal other people's work or to share other people's work so that each of you are doing just one tiny little component. You'll get the most out of this if you do your own work. It's certainly okay to collaborate, but at the end of the day, you must listen or view or somehow take in the information, somehow process that information yourself, and then synthesize and create the final project. What kind of tools do you need to be successful in order for you to complete these projects so that they're meaningful? You'll navigate to the class website. There you'll find all the templates and all the tools necessary to be successful. Let's go right to the template that you'll see for the disease portfolio. You'll notice there are all sorts of different sections here. And in another link, you'll see that each section is identified and we define specifically what it is we want you to have there. Let's look at an example. We've picked asthma, and we've created the asthma example for you. You'll notice here there's nothing cut and paste, no lengthy sections from Wikipedia or some other resource. What you'll find here is high-yield information that's super concise. If I want to know about asthma, really the only thing I care about as a paramedic is knowing about the fact that it causes inflammation, folks have increased mucus, and that they have a reactive airway. I need to know how they're going to present. So the clinical presentation, again, bullet points. It's not lengthy copy and paste. It's not even retyped sections of reference material. We want concise bullet points here. Use, under the assessment section, we want to make sure that the history contains all the important information, and we want you to keep things extremely concise. Physical exam. These are focused exam findings. What kind of things will you be looking for in that patient that presents with those signs and symptoms? Any diagnostic tests to help you determine either the patient's severity with that disease or diagnostic tests to help you understand that the working diagnosis you're working with is on target or that you may be looking at another disease that's presenting similarly. We also want to know about the goals of the pre-hospital therapy. What exactly is it that you would like to do for this patient? So you take into consideration the signs and symptoms, you take into consideration the disease pathophysiology, and from there you should come up with 3 to 5 different items that you're going to plan on doing as part of your treatment. What is that treatment? In the case of asthma, you know there is inflammation, so we want to reduce inflammation. We're going to target that. You know that there's increased mucus and increased secretions. So as a result, we want to dry those folks up so that they can breathe more easily. Last but not least, You know that there is reduced airway size. And as a result of that, they're going to be wheezing. We got to take care of that as well. How do you know when your therapy is working or you can terminate therapy? Again, the endpoint of therapy section is targeting that. We want to make sure that our patients are getting better. What will we measure? What will we look for? What will we try to provoke or elicit to determine that they've gotten better? The transport destination section is designed for any specialty referrals should that particular disease necessitate that. And then last but not least, we want any pearls and pitfalls, things that you should do every single time you view this kind of patient and things that you should avoid doing for those patients. Last but not least, we do want you to include a very brief reference. You don't have to do anything fancy here. We just want to know where you're getting the information from so that we can help guide you. It's exactly the same concept for the medication portfolios. So we've created an example for you and a template, and we've also determined which medications you need. We do not want you to recreate protocols here. What we want you to do is provide yourself with some very concise bullet items about the class, how the medication works on the disease at hand, how it interrupts the disease or completely resolves the signs and symptoms, and what the indications for the use of that medication, what routes you can give it, and then the dosage. So nothing fancy here. It's brief, it's concise, it's high yield. Which medications do you need to know? That's listed in the drug list. You'll open that up, and inside that drug list, you will see every single medication that the paramedic needs to know, and they're also color-coded for you to better understand how much information you need to know about each medication. The last thing you probably want to know is, when are all these things due? So there are very strict guidelines, and the reason for those guidelines is because we want you to be studying those disease processes at the same time that we're working with them in the classroom. So you'll refer to your student schedule, and you'll notice there is a column, and the heading here is called Portfolio. And under the Portfolio heading column, you'll notice that there are diseases and medications that are outlined. For example, on the 22nd, there are no diseases due. There are only medications due, and we've listed those. So please don't hesitate to ask any questions should they arise. We will absolutely work with you. This is an awesome opportunity for you to start the process of learning all the information. We want you to focus on this week's activities. We want you to focus on the material that we're going to be studying and covering in class. And so we've tried to outline the medications that are consistent with that and also the disease processes that kind of go along. Thanks to everyone for their hard work. We'll be with you every step of the way, and we're here to answer any questions should you need.